MERS-CoV, what you need to know. Middle East Respiratory Syndrome. Coronavirus is a viral respiratory illness that was first reported in Saudi Arabia, in 2012. Symptoms are those of a severe, acute, respiratory illness, similar to pneumonia. All known cases so far have been linked to travel or residence in and around the Arabian Peninsula. In 2015, the virus affected 186 people in South Korea, killing 36 of them, after one person brought the virus from the Middle East. This was the largest outbreak so far. Where the Middle East Respiratory Syndrome coronavirus, MERS-CoV, or MERS, comes from remains a mystery, but it probably started in an animal. It has been found in camels and a bat. There is currently no vaccine or cure for MERS-CoV, and so far it has been fatal in around 36% of cases. As coronaviruses tend to mutate, there are concerns that MERS could become a pandemic. MERS was previously known as the novel coronavirus, nCoV. What is MERS? MERS-CoV belongs to the coronavirus family, the same family of viruses that cause the common cold. Human coronaviruses were first classified in the mid-1960s, and 6 of them are known to affect humans, including severe acute respiratory syndrome, SARS, and MERS. Coronaviruses typically infect a single species or species that are closely related, but SARS-CoV infects both humans and animals. Monkeys, Himalayan palm civets, raccoon dogs, cats, dogs, and rodents are all susceptible. MERS-CoV has so far been shown to infect humans, camels, and bats. It is believed to have started in bats and then transmitted to camels. From camels, it can pass to humans, but how this happens is also unclear. MERS-CoV is different from the coronavirus that caused the 2003 outbreak of SARS, but both viruses are similar to the types of coronavirus found in bats. 2 cases of MERS-CoV have so far been confirmed in the United States. One was in Indiana and the other in Florida. Both patients were diagnosed in 2014, both had traveled to Saudi Arabia, and both recovered fully within 3 weeks. All the cases outside Saudi Arabia were travel-related and originated in the Middle East. Symptoms. The most common symptoms of MERS are fever, cough, shortness of breath. Associated symptoms may include chills, chest pain, body aches, sore throat, malaise, a general feeling of being unwell, headache, diarrhea, nausea and vomiting. Serious complications include organ failure, particularly kidney failure, pneumonia. MERS is a flu-like illness with signs and symptoms of pneumonia. Early reports described symptoms as similar to those of SARS. Many individuals with MERS may have a mild respiratory illness or no symptoms. Others will have severe respiratory distress, and they need to spend a long time in the hospital. They may need mechanical ventilation treatment. There is no specific treatment or vaccine for the infection, and there is no cure, but supportive medical care can relieve symptoms and reduce the risk of complications. Prevention. To reduce the risk of MERS-CoV infection amongst travelers, health authorities have offered the following advice. They urge travelers to wash their hands frequently with soap and water, for at least 20 seconds. Avoid undercooked meat or food prepared under unhygienic conditions. Ensure fruit and vegetables are properly washed before consumption. Report any suspected case to the local health authorities to help with worldwide disease monitoring. Minimize close contact with others if they develop an acute respiratory illness with fever, including wearing a medical mask, sneezing into a tissue and disposing of it properly after use, or sneezing into a sleeve or flexed elbow. Seek immediate medical attention if an acute respiratory illness with fever appears within 14 days of returning from travel. Travelers with pre-existing chronic conditions, such as diabetes, renal failure, chronic lung disease are at higher risk. MERS-CoV is contagious, but the virus does not appear to pass between humans without close contact, for example, while caring for a patient without protection. MERS updates. There are currently no trade or travel restrictions related to MERS. Saudi Arabia continues to see sporadic cases of the virus. From 16 to December 31, 2016, Saudi Arabia reported 15 new cases, including 2 fatalities. Another 5 deaths resulted from previously reported MERS cases. While the death rate is relatively high for a person who develops symptoms, the chance of contracting the disease remains relatively small. However, with so little still known about the virus, the situation is open to change.